Hi, my name is Natalie. I'm one of the nurses with OSF Weight Management at the Riverplex, and today we're going to be talking about healthy recovery after weight loss surgery. Pneumonia is one of the number one preventable complications, and there are ways that we can prevent pneumonia by getting your lungs ready and exercising them. First of all, we do not want you smoking, so we ask that you quit at least 1 month before surgery. This is a must to help your lungs to heal. Think of your lungs as tiny sacs, like the size of a grape, and they have to be opened up to prevent fluid from filling in them. If they can't be opened appropriately, fluid will start to fill in these sacs and can cause bacteria to grow, and that's what leads to pneumonia. So a couple different ways that you can exercise your lung to get them prepared for surgery. You can do some pursed lip breathing. So this is where you breathe in through your nose and out through pursed lips. You can practice this on your own or by using kids' bubbles and blowing them several times a day. But this is just really going to help to exercise your lungs and get them to expand and fill up. And another good way that you can exercise and inflate your lungs is by blowing up a balloon. So this will just kind of help you to keep your lungs open. During surgery, they're going to be the anesthesiologist will monitor your lungs, and you'll have a breathing tube in your lungs. They'll also put you on oxygen. This can be drying to your nose and lungs, so it's good to be able to come off of the oxygen as soon as possible. So the healthier your lungs are, the better chance that you can get off oxygen sooner. They'll also put you on IV fluids. The stress of IV fluids can even put some stress on your lungs. So just the healthier your lungs are, the better recovery after surgery. Some lung sacs during surgery might close off, so you'll want to be able to reinflate them as soon as you wake up after surgery. The nurses at the hospital will have you use an incentive spirometer after surgery to help open your lungs. You do not use the incentive spirometer to blow out air, but rather you use it to suck in air and hold it in your lungs. So it helps you to inflate your lungs and keep them inflated for about 3 to 5 seconds. So in the hospital, you will be asked to do this exercise about 7 to 10 times every hour. And you will take the incentive spirometer home and do this 3 to 4 times a day for the next 2 weeks. What are some signs of pneumonia? So these are signs that you want to be aware of. You could start running a fever of 101.5 or greater. You'll feel achy all over. You'll have a more frequent cough, and this cough could be productive, which means you'll have some phlegm that comes up with it. This phlegm changes color from clear to thick and discolored, like a gray, yellow, or green. You can also become short of breath, which can lead to anxiety and feeling restless. Please report any symptom like this to your surgeon. Even if you are questioning whether you have symptoms of pneumonia and you're not sure, please call your surgeon right away. The earlier the treatment can prevent the severity of pneumonia and prevent a longer hospital stay. Another preventable complication is blood clots. Blood clots can happen if you don't get your body moving. So the goal is to keep moving. This keeps the blood flowing and increases circulation of the blood back to the heart. When you're at the hospital, the first time that you get up, you'll get up very early after surgery, but the first time that you get up, you will need assistance. You will log roll to the side and use your arm under you to push up to a seated position. You should take a few deep breaths and kind of get your bearings. And this is very important to take your time before you get up, or you could have a fall. But in the hospital, you'll walk early and you'll walk often. During surgery, they'll put hose on your legs that will inflate and massage your legs to keep the blood moving and circulating during surgery. You may be sent home with Lovenox, which is a blood thinner given by injection. It works by decreasing the clotting factor. If a clot forms in the legs, it can travel to the heart or lungs and become deadly. So please follow your surgeon's instructions on if and how to give yourself a Lovenox injection. Some signs to look for blood clots: redness to the calf muscle that's warm to touch and very painful, swelling in the lower leg, and discoloration to the lower leg. And this will typically only be on one leg. But call the surgeon right away if you notice any signs or symptoms of a blood clot, or if you have shortness of breath. This could indicate a blood clot in the lung. When you have surgery, you experience pain after, but the pain has to be managed. Pain control is crucial to allow your body to rest and relax, which helps you heal. So helping you to relax, this helps your stomach to start moving and pass gas, and it improves your mood. Pain control can help with deep breathing, which is critical to preventing pneumonia and being able to use that incentive spirometer. And pain control is essential to be able to get up and walk, which helps prevent blood clots. So we need to make sure that your pain is under control. Your surgeon will prescribe you a pain medication and a plan that works best for you. Your goal is to keep your pain controlled, but not to the point where you feel like you're doped up from the medication. Preventing dehydration. So we want you to aim for at least 1 liter or 34 ounces of fluid at first, and then drink more as you're able to, with an end goal of about 64 ounces a day. Signs of dehydration: dark urine with a strong odor, not urinating often, low energy, rapid heartbeat, dizzy or confused, thick or foamy saliva. You can check for dehydration by using a skin tenting method. So if you pull the skin between your index finger and thumb and look to see how quickly it goes back in. If it goes back in slow, this could be a sign of dehydration. Goals for discharge. So these things need to be accomplished before you get discharged. So typically it's a 1 to 2 day hospital stay. You have to be able to walk and to walk often. You have to have good pain control, and you have to be able to drink at least the 1 liter of fluid or 34 ounces. You can't have a fever, and you need to have a care partner present to listen to your discharge instructions. If you have any questions in the hospital at discharge, please make sure you ask your healthcare provider. So some of the goals at home: we want to make sure that you hydrate and you're able to progress your diet. Now, this doesn't happen immediately, but works on slowly increasing over time to meet your water and diet goals. Make sure that you're getting up and walking often, so at least 3 times per day we want you up walking. If there's no bowel movement within 3 days, you could try over-the-counter milk of magnesia. Just see the label for instructions. That's something that you can get at the pharmacy. But you'll want to have a bowel movement within 3 days of discharge. If you're on blood pressure medications, check your blood pressure at least daily and report your results back to your primary care provider. If you're diabetic, check your blood sugar at least 2 times a day and report your numbers back to your doctor. Use the stoplights and call your surgeon if you are in the yellow or red zones. So refer to that handout and keep it handy if you're experiencing any symptoms. For diabetic patients, your blood sugar must be below 200 to have surgery. Low blood sugar after surgery: use milk and not juice to help treat low blood sugar. And call your doctor. As you lose weight, your blood sugars could start dropping, so your medications might need to be adjusted. So make sure that you're in contact with your primary care provider after surgery and that you're regularly checking your blood sugars. Follow your surgeon's instructions on crushing medications. Avoid all extended release medications. These will not fully absorb due to the changes in the intestine, so they're not effective after surgery. For gastric bypass patients, avoid all NSAID medications for life. So no aspirin unless you need it for heart protection, ibuprofen, Advil, Motrin, naproxen. These can cause issues of ulcers in the stomach. Please reference your binder for the over-the-counter medication guidelines. This is useful to answer questions about pain meds, sleep aids, allergy medications, cold medications, etc. after surgery. Make an appointment to see your primary care provider 2 weeks after surgery. They will be the ones to monitor and adjust your medications as you lose weight, so it's important to keep in contact with them. So just to recap, please remember to call your surgeon if you're experiencing any concerns after surgery, especially if you're in the yellow or red zones on the stoplight. So things to just be aware of in the yellow or red zones. Make sure if you're having low fluid intake or urine output, this can lead to dehydration. So make sure you're checking your urine color. If you're having extreme or worsening pain, you need to call. Any bleeding, redness, swelling, or irritation at the incision site is something that they need to know. If you have a fever of 101.5 or greater, shortness of breath, productive cough with that thick, discolored mucus, any leg or calf swelling, shortness of breath, prolonged nausea with or without vomiting for at least 12 hours, and persistent gas pain that's not relieved by passing gas. Gas and bloating can be caused by eating too fast, so make sure that when you eat, you're eating slow and you're chewing more. No soda or straws, which can cause more bloating. If you're not able to keep food or fluids down, nausea is one of the number one things that people notice. So here are some techniques that you can use if nausea is related to certain smells or taking your medications. You could try to cut a lemon in half and squeeze it and smell it as you are taking your medications. So that smell of the lemon can kind of dissolve the smells and tastes of the medications. You could also suck on a cinnamon stick or try herbal tea. The aroma of the tea can get rid of the smells that are causing the nausea. If you do not have a bowel movement in more than 3 days, you could try the over-the-counter milk of magnesia, but it might be something to where you would have to call the surgeon if you are continuing to have issues with constipation. And please call if you have a fever of 101 degrees or higher.